Hello, my name is Zahida Bull, and I'm going to give you my view on whether insurance companies should continue to pay for drug treatment facilities time and time again for the same patient. What exactly is the problem? Addiction is not a choice, it's a medical condition. However, it can be considered a moral failing for a long time, which has influenced many insurers to maintain tight restrictions, such as using lifeline limits or requiring multiple failed treatments before authorizing further treatments. Regardless of various studies showing that patients with continual access to treatments are 3 times more likely to complete recovery, and that patients who have ongoing access to treatment are 3 times more likely to maintain recovery, insurers are maintaining their stance. How did we get here? For decades, addiction was misperceived as moral failing, not a disease. Addiction treatment was classified as an essential health benefit with the Affordable Care Act, but we have still seen loopholes that allow insurers to deny coverage. Insurers are also able to deny treatment under the Mental Health Parity and Addiction Equality Act, passed in 2008 to reduce discriminatory practices. A 2022 report from SAMHSA claims almost 1 in 3 patients are denied coverage for care after they relapse. What impact has this had on healthcare delivery? When insurers deny coverage, the ripple effects are devastating. Firstly, for the economy, the National Institute of Health reports in 2025 suggest that costs of the U.S. economy untreated addiction and over $740 billion per year related to healthcare crime and loss. Hospitals see patients returning again and again in the ED because they are not able to access rehab, and the costs are paid for by U.S. taxpayers as people access health care through Medicaid care for incarcerated individuals. Secondly, the most troubling is that we're also losing lives. Over 100,000 people died from overdose in 2022 alone, and many of these deaths could have been prevented with adequate treatment. As a healthcare policy advocate, I firmly believe insurance should cover repeated rehab stays. Here's why. Addiction is a chronic illness. It's a chronic disease. Just like we don't deny insulin to diabetics who struggle with diet compliance, we shouldn't deny care for those battling relapse. Long-term treatment works. SAMHSA study of 2022 found that ongoing care cuts relapse by 50%, while research from the NIDA proves every $1 spent on treatment saves $12 in the future costs. Johns Hopkins calculated that universal treatment access could save $65 billion per year in avoiding emergency services and people going to jail. States that expanded coverage saw results. After Massachusetts improved Medicaid access to addiction treatment, opioid death dropped by 30% just in 5 years. A 2021 study in Health Affairs showed that patients with uninterrupted insurance were twice as likely to stay employed and out of the criminal system. As I come to the end of my presentation, I believe that denying coverage for repeated rehab isn't just cruel, it's a bad policy. If we treat addiction like the chronic disease it is, we save lives as well as taxpayers. Thank you for your time.